Hi, welcome to your FSA Open Enrollment. My name is Rick Neward with the P&A Group, and we'll be spending a few minutes this morning going through how the FSA program works and answering some frequently asked questions. Next slide. Now, how your FSA works, you need to decide how much you want to set aside into your Flex account. You want to use estimated predictable expenses for the upcoming year to set aside that amount into your flexible spending account. There are two different accounts that you have the option to enroll in, and we'll discuss each of those in more detail in the following slides. During open enrollment, which we're in now, you will enroll in your flexible spending account, and your open enrollment period is October 1st, ending October 30th. And it is important that even if you're currently participating in the flexible spending account, you do need to make a new election every single plan year. Your election does not carry over from one year to the next. So it's important to remember that every year you need to make a new election. To start using your FSA on January 1st, which is the start of your plan year, your annual election contribution will be divided by the number of paychecks in a year, and it will be deducted from your paycheck on a pre-tax basis. And that's the benefit to using the flexible spending account. All of your contributions are made with pre-tax dollars. Next slide. To give an example of what that deduction would look like for an election of $780 for the year, you would divide that by 25 pay periods, and $31.20 would be deducted from your paycheck and go into your FSA every pay period. Keep in mind, again, that's pre-tax dollars. So your take-home pay will not go down by $31. It will go down by $20 to $25 because you're avoiding paying those income taxes on that contribution. Next slide. As I mentioned, there's two different accounts available to you. The Health FSA covers the cost of medical, dental, and vision expenses for you and your eligible dependent. The Dependent Care FSA is used to cover the amount you pay to daycare centers, babysitters, after-school programs, day camps, and elder care facilities. And we'll talk a little bit more about each of those accounts now. Next slide. The Health FSA, there's several rules that you need to be aware of. One is your full annual election is available to you on the first day of your plan year. So if you determine that you need $1,000 in your Health FSA for the upcoming calendar year, that amount's going to be pre-funded in your account on January 1st and available for you to spend. Now, it's important to note though, you're only allowed to change your election if you have a change in status. For example, marriage, birth of a child, divorce. Those would be qualifying events that would allow you to change your election during the year. Other than that, you are committed for the upcoming plan year and you would not be allowed to change your election. This account does have the rollover feature, which means that any unspent funds between $10 and $550 will roll over into the next plan year. And that's important for you to keep in mind that if you don't spend all the money by the end of the year, December 31st, unused funds will roll over up to $550. So it's important you spend down your account balance to at least $550 so that you don't forfeit anything. There are limits on the amount that you can contribute. The maximum contribution annually is $2,750, and the minimum contribution is $0. There are some questions that have come up as a result of the COVID and some of the CARES Act provisions, which allowed for some relief related to flexible spending accounts, which I want to address now. The first one of those is, will mid-year election changes be allowed in 2021? And the answer is no, unless you experience a qualifying or life event. The temporary relief that was provided by the IRS during COVID 2020, allowing for mid-year changes without a life event, expires on December 31st. So that relief, that freedom to change, enroll, and cancel during 2021 will not be available. Next question is, how much funds from 2020 FSA will roll over into 2021? An unused 2020 FSA dollars up to $550, as I mentioned, will roll over into your 2021 healthcare FSA account. Any amount above $550 will be forfeited. Next question is, if I still have funds from 2019 that rolled over into 2020, can I use those funds in the upcoming 2021 plan year? And it's important for you to note that rollover funds from 2019 to 2020 need to be spent by the end of this year, December 31st, 2020. Any amount remaining in your 2019 rollover will not roll over to 2021. Next question is, if I have funds that expire at the end of December 2020, what can I use my FSA funds on? The CARES Act, passed in March of 2020, expanded the list of eligible expenses that you can spend your healthcare FSA dollars on. Eligible expenses now include over-the-counter medications that previously required a prescription, as well as menstrual care products. These items can be purchased using your FSA debit card at most major retailers. And for an expanded list of eligible expenses, you can visit the P&A Group website and access a more extensive list of products available. Next slide. Some other sample expenses in addition to the over-the-counter medications, which I mentioned: copays, deductibles, prescriptions, dental work, eyeglasses, contacts, saline solutions. The over-the-counter medications, again, that do not require a letter of medical necessity or a prescription, and feminine care products are also available now without a prescription. Next slide. The FSA Store is a partner with the P&A Group, and this is a great resource for participants to learn about what expenses may be eligible, and also gives you the opportunity to purchase those items directly from the FSA Store using your P&A issued debit card. You'll notice that there's free shipping on orders over $50, and everything is 100% guaranteed to be eligible. So it takes the guesswork out of figuring out what you can spend your FSA money on. Next slide. The second account that's available to you is the dependent care account. There are a couple of differences between dependent care and the healthcare FSA, which we already touched on. The first one is this is a pay-as-you-go account. That means that as the money is payroll deducted from your paycheck, it gets deposited into your dependent care account and then becomes available for reimbursement. So if you pay your daycare provider in advance for the month and you submit that bill to P&A for reimbursement, we can only reimburse you what's been payroll deducted to that point. Any amount that is unreimbursed, so any amount of that claim that you don't have funds to reimburse, will remain on file with us, and as payroll deductions continue to occur, we'll continue paying down that expense that you submitted for reimbursement. Okay. Again, you can only change your account if you have a change in status, and we'll get into what those rules are in a little more detail in a second. And this is a use it or lose it account, meaning unused funds do not roll over to the next plan year. So if you have money remaining in your dependent care FSA for 2020, it's important that you spend that money by December 31st. There are some contribution limits for this account as well, $5,000 annually per household. Unless you're married filing separate returns, then your maximum is $2,500 for the calendar year. Now, again, we have some questions that related to this account in light of COVID. And the first one is, can I get a refund for unused dependent care FSA? There are a lot of participants in this account this year that were anticipating being able to spend this money on daycare, summer camps, after-school programs, and as we know, a lot of those programs have not been available to participants, meaning that in some cases they have money available in the account and they're unsure of how to spend it, and they're questioning whether or not they can get a refund. Current IRS regulations do not permit refunds of dependent care contributions, okay? And keep in mind, this is an IRS rule regulation that we are following. Back in May of 2020, the Health Service Board approved mid-year changes to your FSA account as a result of the CARES Act. Members could make this change by calling member services or through e-benefits. Members were notified in the DHR newsletter and San Francisco Health Service Center e-news and San Francisco Health Service Center website about this change, where you had the opportunity to change or stop withdrawals to your FSA account. Again, important to note, any unused 2020 dependent care FSA dollars will be forfeited. So try and spend this money before the end of the calendar year. Next question is, if my child's daycare already charged me for daycare services in 2020, but is applying it towards future daycare services, can I get reimbursed for the fees they charged in 2020? The answer is no. Participants need to incur the expense, and services must be rendered by December 31st, 2020 in order to be eligible for reimbursement from this year's dependent care balance. There is no carryover of unused funds, and participants have until March 31st of 2021 to submit those expenses for reimbursement. Again, important to note, the IRS regulations do not permit refunds of dependent care contributions. So it's important you spend your money. It cannot be refunded. The next question is, how should I plan for 2021 dependent care FSA with all the uncertainty of daycare centers opening or closing due to the ongoing pandemic? And this is one area that fortunately the IRS does have some relaxed mid-year change rules. All right, and those are as follows. If you have a birth or adoption, that is considered a qualifying or life status event change that would allow you to enroll in dependent care mid-year. So obviously adding a dependent, the IRS views as a need arises now for dependent care services with the addition of that dependent. That would be an opportunity for you to get into the plan at that time. The other one, and this is the one that's probably more applicable in light of the pandemic, is the need for service changes. This means if you previously didn't need dependent care services because you or your spouse were at home, but now are returning to work, that would then qualify for a mid-year change to enroll or increase your dependent care election. On the flip side, if you were using dependent care services and now you or your spouse will be working from home, then you could decrease or cancel your election. It's important to note, though, if you're going to be canceling or decreasing your election, you can only reduce your election amount to the amount that was already reimbursed to you or to the amount that you have already contributed, meaning that you couldn't reduce it to some amount less than what you put into the account, entitling you to a refund, because as I noted earlier, no refunds of dependent care contributions as a result of canceling or reducing your election. The other one that's important, this is the other event, life event that would allow you to make a change, the cost of service changes. If the provider you are using increases or decreases their cost, you can change your dependent care election accordingly. So as you can tell by those questions and answers, there is a little bit more freedom with the dependent care account with all the uncertainty regarding the upcoming year. If you're not comfortable or confident that you'll be able to spend the money, you can wait to make an election until you know that daycare is going to be accessible to you. Next slide. Some sample dependent care FSA eligible expenses, after school programs, caregivers for a disabled spouse or elderly dependent. It's important to note on those two that if they are disabled or an elderly dependent living with you, you need to claim them as a dependent on your tax return. That's the qualifier to make sure that they are eligible to spend this money on. Obviously, daycare centers for children up to the age of 13, day camps, overnight camps are not allowed. One thing I want to touch on here is we've received a lot of questions regarding virtual camps. And the IRS has a series of tests to determine if dependent care expense is eligible. The first one is, do they require adult supervision to participate in that act? And with virtual camps, the IRS stance is that they are still at home with either a parent or a caregiver. So the cost for that virtual camp is not eligible for reimbursement. But if you're paying somebody to supervise the children while they're participating in that virtual camp, the cost for that supervision is an eligible expense because now you're paying a provider to take care of the children while they participate in that virtual camp. Elder care and nursery schools as well. Next slide. For anybody that enrolls in the flexible spending account, you will automatically receive from the P&A group a MasterCard debit card that's going to be linked to your health FSA and or dependent care account. These cards are good for 3 years from the date of issue. So if you're currently participating in the flexible spending account, you can look at your debit card and you'll see an expiration date on there. If your card is set to expire, don't worry, you don't need to do anything. P&A will automatically issue you a new debit card. You can also order additional debit cards or replacement debit cards by accessing your account on our website. We don't have any fees for the debit card. So you can order replacement cards or additional cards at no cost. The cards that we issue are smart cards where they're going to be restricted based on where you're shopping and what you're purchasing. So I will tell you, if you try and use your Flex debit card at the gas station, the card's going to be declined at that location because we don't look at that as an authorized merchant to provide healthcare services. Now, if you use your card at the doctor's office, the dentist's office, the optician, those are all eligible merchants. In addition, there are big box retailers, grocery stores, Target, Walmart, CVS, Rite Aid, Walgreens. Those merchants have systems in place that identify eligible items and items that would not be eligible, like groceries. So if you're using your debit card to purchase a week's worth of groceries and a box of Band-Aids, the Band-Aids will go through on the card, the groceries will be declined. So it's important to note that the card is only going to allow you to purchase eligible expenses. You may, on occasion, get requested for documentation, meaning that if you use your card at a location we can't determine was eligible, we will send you a request to provide backup documentation to support that transaction. So it's important that you hold on to receipts. We will request that information immediately after the transaction. If you don't hear from us within a couple of business days, that transaction was okay without documentation needed. Next slide. There's a variety of ways you can get access to your flexible spending account information, whether it's through the P&A Group website, by calling our 800 number and talking to customer service, or using our automated voice response system. In addition, though, P&A has a great mobile app that you can download from the Google Play or the Apple App Store. And you can download that, and it allows you to view your account information. You can set up account alerts where we will send push notifications through the mobile app. You can also submit claims through your mobile device by taking a picture and uploading it from your photo library. We allow you to upload debit card documentation, and we also have an easy scan feature. The easy scan feature is great if you're at a store, you're not sure if the product you're looking at is eligible for reimbursement from the FSA. You can open up our app, scan the barcode on that product, and it will tell you whether it's an eligible product, or maybe it requires documentation from your doctor verifying that you need that service or product. Next slide. P&A's customer service, we're open Monday through Friday, 5:30 a.m. to 7 o'clock p.m. Pacific time. During those same hours, we also offer live chat. So if you're working at a computer and you prefer to instant message with customer service, you can do that. And our toll-free phone number there, 1-800-688-2611. We have customer service reps available during those hours, available to answer any of your questions. Next slide. And again, I've mentioned our website several times, www.padmin.com, padmin.com. Provides a lot of resources to learn about your flexible spending account, and also when you enroll, to access your account balance information. Thank you very much.